Today's topic of discussion is regular blood tests for a healthy heart. Well, as you're perhaps aware of the fact that number of illnesses reported by people are increasing at an alarming rate. And some of these illnesses are pretty serious, like heart attacks and stroke, when they'll end up at the doctor's chamber or in the hospital emergency department. That is bad news. The good news is that most of the diseases or illnesses are preventable. Actually, a regular blood test at regular intervals give us some information, a snapshot about your health, and a wealth of other information also, from which the doctor can gauge what is the current situation and also what is the situation going to be there in the future. And therefore, we can take apt steps at the present time and prevent major illnesses happening in the future. So that is a good news. And for that, we need regular blood checks-up. Now, as I say, a stitch in time saves 9. Now, the screening test gives us a wealth of information regarding various things like, your blood sugar level, your cholesterol level, and we can correlate with your symptoms. Like if someone has a fatigue, someone has shortness of breath, increasing in weight or reduction in weight recently, some development of the pain and whatever, then we can, gauge from the blood test and correlate with your symptoms and find out a solution for that and find out the diagnosis from that. Now, the blood tests are pretty simple things to do, basically. We only need a simple, very simple syringe with a very thin needle. Take a little bit of sample of blood from your arm, which is not more than 1 to 2 millimeter. And with only a little bit of blood, we can get a lot of test reports, like blood sugar, blood cholesterol, total blood counts, and whatnot. And from that, we can deduce a lot of things. Now, usually we do not require any special precautions for blood tests, except that sometimes when your doctor tells you that you need to fast overnight for about 10 to 12 hours without taking any food or drinks except clear water that you can have. And after that, a blood sample is taken and sent to the lab for testing. Now, let us look at a couple of blood tests which are regularly done. Number 1 is the blood sugar levels, and number 2 is cholesterol levels. Now, why we do the blood sugar levels? We do the blood sugar level to see if you have a diabetes problem or if somebody is at the risk of developing diabetes in the future. Now, for that, usually we do 3 tests. The first test is hemoglobin A1C or glycated hemoglobin. This gives us an idea, an average of blood sugar for last 3 months prior to taking the sample. It should be around, between 6 to 8%. We'll come to that a little later. And we can take a fasting blood sugar sample or to check what is the fasting blood sugar level in your body. That is taken after a fast of 8 to 12 hours of overnight fasting, after about proper rest. Then we take the blood sample in the morning and measure the blood sugar level. The second is OGT, oral glucose tolerance test. Now this is taken, the first sample is taken fasting, as I said before, just now, and the second sample is taken 2 hours after giving you a sugary drink, usually 75 milligrams of glucose, sorry, not milligrams, 75 grams of glucose, and after 2 hours, we take a blood sample and take the readings. Now, why we go to all these, problems? Now, first of all, we need to realize that diabetes occurs because of lack of insulin in the body or lack of effectiveness of the insulin which is secreted in our body. We need insulin to break down glucose in our body, and by breaking down glucose in the body, we produce energy which is required for our day-to-day activities. Now then, if we cannot break down the glucose in our body because of lack of insulin or less effectiveness of the insulin in our body, then the blood glucose accumulates in our body, and the condition called diabetes mellitus happens. And diabetes, unfortunately, affects all the organs of the body, from the head to the tip of the toe in our feet. Now then, main organs which are involved when the diabetes is uncontrolled is the brain, where you can have a stroke, the heart, where you can have a heart attack, the kidneys, when we can have kidney failure, and we can have also other problems in the nerves and the feet, and we can end up with amputation and stuff like that. Also, the eye is another target organ of diabetes, and blindness can develop in uncontrolled diabetic people. So we need to control diabetes very effectively. So for that, we need these levels. In a diabetic, of course, we need to know the levels. And we need to know the levels is that hemoglobin A1C in a diabetic should be around 8% now or less. And the fasting blood sugar level should be 100 to 130 milligram percent. And fasting, that is the fasting one, and the PP blood sugar should not be more than 180 milligram percent. Now, measuring blood glucose at home is very simple. All you need is a small machine which is called a glucometer, and there are some sticks. We can insert the sticks into the meter, and from a small prick in the fingers, and you can measure the blood glucose very easily. How often we need to do it, and how frequently we need to do it, your doctor will tell you depending on the stage of your disease and depending on what treatment measures are taken. So this is about diabetes in very short and nutshell. Now, next test, we usually look at the blood cholesterol level. This is called a lipid profile. In this lipid profile, we look at the various components of fats in the body. The three components we basically look at are total cholesterol, the LDL cholesterol, and the HDL cholesterol, and the triglyceride. Total cholesterol is should not be more than 200 milligram in your body per liter, 200 milligram percent, 200 milligram per deciliter in our body. And LDL cholesterol, which is called low density lipoprotein, or it is also known as the bad cholesterol. It accumulates. The bad cholesterol is the culprit for a lot of diseases, and the cardiovascular diseases. These bad cholesterol accumulates in your vessels, particularly in your arteries, and they gradually build up inside the arteries and gradually block the arteries partially and sometimes completely. When it blocks the arteries, there's less flow of blood in the arteries, and therefore blood cannot carry enough oxygen to the organs the artery supplies. Therefore, if it happens in the heart, it can cause a disease called heart attack or disease called angina and various kinds of other problems. If it happens in the brain, if it blocks the artery, it can cause a cerebral infarct or a stroke. So similarly, if the small arteries in the kidneys are involved, then kidney failure happens. So this is an important issue. So we need to reduce the LDL cholesterol. There are various measures to do it, but the level we should know is that it should not exceed more than 130 milligram percent or 130 milligram per deciliter. Now, it should be less than 100 milligram per deciliter in a diabetic patient or a patient with a heart problem. Now, on the other hand, the HDL or high density lipoprotein is called the good cholesterol because it sweeps off the bad cholesterol from your arteries and clears the arteries. So we need a high level of this. We need about 45 to 55 milligram per deciliter in our body. And therefore, we should also look at the level of HDL level in our blood. The third thing is triglycerides. This is another kind of fat in the body. When it accumulates in our body, when we have more calories than we can burn. And therefore, it accumulates in our body and it is associated with increased incidences of heart diseases, particularly heart attacks. So various measures are available, particularly, your doctors will tell you the low-fat diet, regular exercises, etc., and That's another topic for another day. But in nutshell, if we know all this, we can predict that what kind of measures we need to take. The third thing, of course, if we don't talk about blood pressure today, our topic of discussion will not be controlled. Blood pressure is a dangerous condition if it is elevated beyond the point. And this is a very quiet kind of enemy. It comes very quietly, and unless somebody checks the blood pressure level, we do not know the person has high blood pressure or not. Actually, blood pressure is the pressure exerted by the column of blood, which is pumped out by the heart, and then it exerts some pressure in your arteries. Now, that is called the blood pressure. The blood pressure have got two components. First component is the upper component, that is called the systolic blood pressure, and the lower component, which is called the diastolic blood pressure. Now, the systolic blood pressure is the pressure exerted by the column of blood on your arteries when the heart contracts, basically. When heart pumps, it contracts first, and that is the pressure exerted on the arteries. There's the systolic blood pressure. And when the heart rests between the two beats, then also there is some pressure exerted in the arteries, that is called the diastolic blood pressure, or the lower case of the blood pressure. So in the systolic blood pressure in a normal person should not be more than 120, and the diastolic blood pressure should not be more than 80 millimeter of mercury. The blood pressures are always expressed in millimeter of mercury. And if somebody has got blood pressure of more than 140 systolic and or more than 90 diastolic, then it is called hypertension, and we call the patient is hypertensive. We call the patient has got high blood pressure. Several measures can be taken. The blood pressure is one of the simplest measures or measurement by which you can gauge your blood pressure. There are two kinds of machines with which you can measure the blood pressure. One is called the digital type of blood pressure, which is widely used all over the world. The other is the dial type blood pressure machines, which is called the Android blood pressure machines. Now, here it's important to remember mercury blood pressure machines or mercury manometers are no longer used all over the world because of there may be a risk of mercury toxicity when the mercury is almost indestructible. And when it spills from the machine, it can cause a lot of poisoning. So that's another issue though. But anyway, the blood pressure also can be measured at home by yourself, the patients themselves. And it is very simple to do. And your doctor described how to do it. Again, the easiest thing to do is by using a digital manometer or digital blood pressure machine. Usually, the blood pressure at home is measured over 7 consecutive days and 2 times a day. The first time it is measured between 6 a.m. and 12 midday. It is measured twice a day, twice every time. And second measurement is taken during the evening between 6 p.m. and 12 midnight. And 2 readings at each time is taken, and usually the lower reading is taken, and the second reading is taken, and the first reading is discarded. And if there is wide variation between the 2 readings, then of course we need to take 2 or 3 further readings, and usually average of the 2 lower readings are taken. Now, blood pressure gives us a wealth of information of the current health and possible future implications of development of cardiovascular diseases or heart diseases. Now, it's very important to realize that simple lifestyle measures like low salt intake and regular exercises, etc., reduction of weight can go a long way to return blood pressure to normal in a hypertensive patient if it is not too much. But if the blood pressure is pretty elevated, then of course one can require blood pressure tablets or medicines. It is very important to realize that if we reduce the blood pressure in a hypertensive patients or patients with a high blood pressure, by a very minimal degree also, there may be great reduction in the risk of development of the heart diseases in the future. Now, the moot question today, of course, is that, I want to remind you again, simple blood tests Simple blood pressure management will go a long way in preventing serious illnesses in the future. And I would strongly advise that blood pressure measurements should be done regularly, and regular blood tests should be done at least once a year. We must always remember the old saying that prevention is better than cure. And if we catch the disease or possibility of developing disease early, then we can prevent a catastrophe in the future. That is why, as they say, a stitch in time saves nine. Thank you very much.